My name is Daphne Broadhurst. I'm a clinical nurse specialist with Infusion Excellence Consulting. You've learned how to use your Easypump. You always need to be checking that everything is working well and that you're responding to your medicine as expected. You need to be able to notice if a problem happens and what to do to fix it. Always check your pump before you use it. Do not use it if it's past the expiry date, if the wrong name or the wrong drug is on the label, if the balloon splits or leaks or fluid has leaked, if the cap on the end of the pump is missing or the cap on the top of the pump fell off. Later you would call your healthcare provider to tell them that you would be short one pump. They may ask you to keep the pump to send it back to the pharmacy when the next order is delivered so they can look at it. If the pump leaks, close the clamp on the pump. Take the pump tubing off the PICC or IV and flush the IV as you were shown. If it's taking longer than you were told for the pump to empty, there's a couple of things you can do. If you are in a cold temperature, place the pump under your clothes, closer to your body. Did you remember to take the pump out of the fridge at least 6 to 12 hours before it was time to give your medicine? Is the end of the pump tubing taped directly to your skin? This is called the flow restrictor. Remember, it controls the speed of the flow of medicine. It needs the warmth of your skin to flow at the right speed. Make sure the pump is close to the same height as your IV. If it's low, then the pump will flow slower. Look at your IV and the tubing to make sure they're not kinked or bent and blocking the flow. Are there any clamps on the tubing or the IV or PICC? And if so, are they fully open? You can disconnect the tubing and try flushing your catheter if it's not running well, but make sure you keep the end of the tubing clean. If the balloon is emptying faster than you expected, you can check for a couple of things. Is the pump exposed to really warm temperatures or in the sunlight, perhaps under your bedclothes? Check your temperature to see if you have a fever. Heat can make the pump flow faster. Was the pump in a higher position than your IV or PICC? If so, height can make it flow faster. Keep it close to the height of your IV. Was anything putting pressure on the Easypump? For instance, were you sitting or lying on the ball? This can cause the pump to run faster. Now, what might you notice if you have an infection? You're going to watch for perhaps a fever, or you may have an infection at your IV site. If your skin, where the IV enters your body, is red, warm to touch, swollen or tender, there may or may not be pus or discharge under the bandage. If you notice any of these signs, call your healthcare provider or go to emergency if you're really sick. Call the nurse if your bandage is loose or dirty. It likely needs to be changed. If you weren't shown how to change your bandage, call your healthcare provider to get the bandage changed. If your catheter won't flush, make sure the clamp on your IV or PICC, if there is one, is open. Move your arm, cough, take a deep breath. When you're flushing, you can gently push and pull on the tail end of the flush. But remember, never push hard. If it still won't flush or it's feeling pretty hard to flush, call your nurse. You've learned what the Easypump is, and you're learning how easy it will be to use. Hopefully you'll find, as other patients have, that it's actually pretty easy to use the Easypump in the safety and comfort of your own home, at work or at school, or even on vacation. Thank you. I'd like to thank Formative Pharma for their educational grant to support the development of this video. Thank you.